Think about your recent weeks. Have you felt more tired than usual? Maybe you've noticed you get winded doing things that used to feel easy. Perhaps you've had stomach discomfort or unusual sweating. Most of us experience these things and assume they're just part of getting older or life stress. We normalize them. But what if they were worth mentioning to your doctor? Hello, I'm Dr. Livia Carter. I work in preventive health education, which means I help people understand how to recognize changes in their bodies and have better conversations with their doctors. I'm not here to diagnose anyone or create worry. I'm here to share educational information that might help you become more aware of your health. Everything I share today should be discussed with your own doctor, who knows your complete medical history. I want to walk through 10 changes that doctors say are worth paying attention to. These aren't dramatic or obvious, which is exactly why many people miss them. For each one, I'll explain what it is, why your body might experience it, and most importantly, when it's worth mentioning to your healthcare provider. By the end of this video, you'll have information to recognize patterns in how you feel. You'll know which changes deserve a phone call to your doctor, and which ones are worth mentioning at your next checkup. Most importantly, you'll feel more informed and empowered about your own health. Before we continue, I need to be very clear about something important. This video is for educational purposes only and is not medical advice. Nothing here should replace a conversation with your doctor. If you're experiencing chest pain, severe shortness of breath, or sudden unusual symptoms, please call emergency services immediately. Don't wait. Every person's body is different, and what matters for your health is what your individual doctor says about your situation. Symptom number 1, unusual fatigue. Let's start with something many people experience but often overlook: feeling more tired than usual, even when you've rested well. I'm not talking about normal tiredness after activity. I'm talking about a persistent heaviness, a sense that your energy is lower than your baseline. Your doctor can explain the reasons this might happen. It could be related to many different things: your sleep quality, your activity level, your nutrition, stress, or changes in how your body is functioning. The important thing is noticing when something feels different for you. The good news is that noticing this pattern means you have information to share with your doctor. Your doctor can run tests and help you understand what's happening. You're not being overly cautious, you're being observant, and that's valuable. Pay attention to whether this fatigue is new for you. Has it developed over weeks? Does it feel unusual compared to how you normally feel? These observations matter when you talk to your healthcare provider. They help your doctor understand your individual situation. Many things can cause fatigue: sleep problems, stress, medications, nutrition, activity levels, or medical conditions. Only your doctor can help you figure out what's using it in your case. The point is, it's worth mentioning. If you're a woman, research shows women sometimes report fatigue-related changes differently than men do. Whatever your gender, your own experience of your body is important information. Have you noticed yourself feeling more tired than usual, even after rest? That might be something worth jotting down before your next doctor's visit. Remember, noticing these things isn't worrying. It's wellness. You're paying attention. That's positive. Symptom number 2, shortness of breath. Another change people sometimes experience is noticing they're breathing a bit harder than they used to during regular activities. Maybe climbing stairs requires more effort, or you notice your breath changes during conversation. Your doctor would want to know about this because there are many possible reasons it could happen, and some of them are worth investigating. Your body's breathing responds to many factors: your fitness level, your stress, your overall health status, altitude, anxiety, and many other things. Noticing a change in your normal breathing pattern is worth mentioning to your doctor. If you've noticed this, the positive step is bringing it up with your healthcare provider. They can evaluate you, run tests if needed, and help you understand what's normal for your body and what might need attention. The key is noticing what's different for you. You know your baseline better than anyone. If your breathing feels unusual compared to your normal pattern, that's information worth sharing. Many things affect breathing: your fitness level, anxiety, environmental factors, sleeping position, and various health conditions. Your doctor's job is to help you understand what's causing the change in your specific case. Some people notice this happens more with activity. Others notice it at rest. Some people notice it at certain times of day. Whatever pattern you see, write it down. These details help your doctor. Have you noticed changes in how easily you breathe during activities you normally do? That's worth mentioning to your doctor. By paying attention and reporting these details to your healthcare provider, you're giving them the information they need to help you. Symptom number 3, chest discomfort or pressure. Some people report experiencing sensations in the chest area, pressure, tightness, heaviness, or discomfort. This is something your doctor absolutely needs to know about if you experience it. Chest sensations can have many different causes, and your doctor is trained to help you understand what's happening in your specific situation. The important thing to know is that chest discomfort can feel different for different people. It might feel like pressure. It might feel like squeezing. It might be mild or more pronounced. Whatever you feel, your doctor needs to evaluate it. If you experience chest discomfort, the positive action is contacting you or doctor. Don't try to figure it out yourself. Your doctor has the tools and training to help you understand what's happening. Notice the pattern. Does it happen with activity? Does rest make it better? Does it come and go? Is it new? These details matter, and your doctor will want to know them. Chest sensations can come from muscle tension, anxiety, digestive issues, or various health conditions. Your doctor can help sort out what's happening in your case. The point is, it's not something to ignore or self-diagnose. It's something to discuss with your healthcare provider. Some people experience discomfort in other areas too. Their back, their arms, their neck. These can all be worth mentioning to your doctor as part of the overall picture of how you're feeling. If you've experienced chest discomfort, did you mention it to your doctor, or would it help to bring it up at your next visit? Your doctor is there to evaluate these things. That's their job, and they want to help you understand your health. Symptom number 4, unusual sweating. Some people notice they're sweating more than usual, particularly in ways that feel different from normal heat or exercise sweat. This might be cold, clammy sweating, or night sweats that wake them up, or just unusual dampness throughout the day. Your doctor would want to know about this change. Sweating can happen for many reasons: environmental temperature, activity level, anxiety, hormonal changes, or various health conditions. When you notice a new pattern, that's information for your doctor. Noticing these changes is good self-awareness. Reporting them to your doctor is taking positive action toward your health. The specific thing to notice is this new for you? Is it different from your normal patterns? Does it seem unusual? Trust your own awareness. You know your normal baseline. Many conditions can cause changes in sweating: hormonal shifts, anxiety, various medical conditions. Your doctor can help you understand what's happening in your case and whether any action is needed. If you're experiencing night sweats, that's something definitely worth mentioning to your doctor at your next appointment. It helps them get a complete picture of what's happening with you. Have you noticed sweating patterns that feel unusual or different from your normal? That could be worth discussing with your doctor. Symptom number 5, pain or pressure in arms, neck, or jaw. Some people report experiencing discomfort in their arms, neck, jaw, or shoulders. This might feel like aching, pressure, tingling, or numbness. Because this can be caused by many different things: muscle tension, nerve issues, various health conditions, it's important to mention it to your doctor. Your doctor can help you understand whether this is related to muscle tension, nerve issues, or something else. The point is, new pain or pressure in these areas is worth reporting. If you're experiencing this kind of discomfort, your doctor has ways to evaluate it and help you understand what's happening. You don't have to figure it out yourself. Notice where the discomfort is and when it happens. Does it come with activity? Does it happen at rest? Is it constant, or does it come and go? These details help your doctor create a complete picture. Most arm pain, neck pain, and jaw discomfort has various causes. Your doctor can help you figure out what's causing yours and whether any treatment is needed. If you notice this discomfort alongside other changes you're experiencing, other items on this list, for example, definitely mention the whole picture to your doctor. Have you experienced discomfort in your arms, neck, or jaw that felt unusual or new to you? Symptom number 6, indigestion or nausea. Stomach discomfort is something everyone experiences sometimes. But if you're noticing new or unusual digestive sensations, nausea, heaviness, feeling full quickly, or indigestion that doesn't respond to your usual remedies, that's worth mentioning to your doctor. Stomach changes can result from diet, stress, medications, and various health conditions. Your doctor can help you understand what's causing changes in your specific situation. The good news is that digestive changes are something your doctor evaluates regularly. It's easy to bring up, and it gives your doctor valuable information about your overall health. If your usual approach to managing digestive discomfort isn't working, or if something feels different, that's a signal to mention it to your healthcare provider. Nausea and indigestion can have many causes. Your doctor helps you understand what's happening and whether anything needs to be done about it. Some people describe a loss of appetite or a general sense that food doesn't appeal to them. If that's unusual for you, it's worth mentioning. Have you experienced digestive changes that feel new or different from your normal patterns? Symptom number 7, dizziness or lightheadedness. Dizziness or lightheadedness can happen to anyone for many reasons: dehydration, standing up too quickly, medication side effects, anxiety, and various health conditions. When you notice it happening, your doctor would want to know about it. The important thing is recognizing when dizziness is new or unusual for you. That information helps your doctor understand whether it needs evaluation. Most dizziness isn't serious, but your doctor needs to evaluate it to know for sure. By reporting it, you're giving your healthcare provider important information. Notice when it happens. Does it occur during activity, at rest, when you stand up, when you're stressed? Does the room feel like it's spinning, or does it feel more like lightheadedness? These details matter. Dizziness can result from many things. Your doctor has experience evaluating what's causing it and whether action is needed. If dizziness happens alongside other changes you're noticing, definitely mention the whole picture to your doctor. If you've experienced new dizziness or lightheadedness, have you mentioned it to your doctor yet? Symptom number 8, unusual weakness. Some people report noticing that their muscles don't seem as strong as usual, or activities that normally feel easy suddenly feel harder. This kind of weakness can have many causes: your activity level, your nutrition, your medications, sleep quality, stress, or various health conditions. Your doctor would want to know about this. The key is noticing when something feels different from your baseline. You know how strong you normally feel. If that changes, it's worth mentioning. Weakness is your body's way of sending information. By paying attention and reporting it, you're gathering important health information for your doctor. Notice whether this weakness is throughout your whole body or in specific areas. Does it come and go, or is it constant? Does it feel worse at certain times? These observations help your doctor. Weakness can result from many things: your fitness, your nutrition, sleep, stress, or health conditions. Your doctor helps you understand what's happening and what might help. If you're experiencing weakness that interferes with your normal activities, that's definitely something to mention at your next doctor's visit, or sooner if it's significant. Have you noticed weakness or lack of strength that feels unusual for you? Symptom number 9, sleep disruptions. Changes in your sleep patterns can be important information for your doctor. This might include waking up frequently, restless sleep, needing more pillows to feel comfortable, or finding that you sleep better in certain positions. Sleep changes can result from stress, medications, your sleeping environment, anxiety, age-related changes, or various health conditions. When your sleep patterns change noticeably, your doctor would want to know about it. Good news. Sleep problems are something doctors regularly help with. There are often solutions, and understanding what's causing the change is the first step. Notice what changed about your sleep. Are you waking up more? Do you need a different sleeping position? Does your sleep feel restless? Are you having trouble falling asleep or staying asleep? These details help your doctor. Sleep changes can happen for many reasons. Your doctor can help you understand what's causing them and what might help you sleep better. If you're noticing that you suddenly need more pillows, or that you sleep better in a recliner than in bed, or that your sleep quality has changed, these are worth mentioning. Have you noticed changes in your sleep patterns recently? That might be worth discussing with your doctor. Symptom number 10, feeling anxious without clear reason. Some people experience unusual anxiety or a sense of unease that they can't quite explain. You might feel restless, worried, or have a general sense that something's not quite right. This could be purely emotional. It could be related to various health conditions, or it could be a combination. Your doctor would want to know about this. Anxiety can have many causes: stress, life situations, anxiety disorders, caffeine, sleep deprivation, various health conditions, or medication effects. When it's new or unusual for you, it's worth reporting. The fact that you're noticing your own mental state is positive. Being aware of how you feel emotionally is part of whole person health. Your doctor can help you understand what's happening. Notice whether this feeling is new or whether it's different from your usual baseline. If you normally feel calm but recently feel on edge, or if you normally experience anxiety but this feels different, that information matters. Anxiety can result from many things. Your doctor, and possibly a mental health professional, can help you understand what's causing it and how to address it. If this feeling is accompanied by other physical changes you're noticing, like fatigue, sleep changes, or other items from this list, mention the whole picture to your doctor. Have you experienced unusual anxiety or unease that felt different from your normal baseline? That could be worth discussing with your healthcare provider. I'd like to hear from you. Have any of these changes resonated with your experience? Have you noticed one or two of these in your own life? Drop a comment below. Your honest experience helps me understand what information is most helpful to people, and it reminds all of us that we're not alone in paying attention to our health. This video is for educational information only. It is not medical advice, and it is not a substitute for talking with your doctor. Every person's body is different. Every situation is unique. If you're experiencing chest pain, severe shortness of breath, fainting, or any symptom that feels like an emergency, call emergency services immediately. Do not wait. For any symptom described in this video, your next step should be a conversation with your own doctor. Your doctor knows your complete medical history, your medications, your family history, and your individual health situation. Only your doctor can properly evaluate what's happening with you and recommend appropriate action. This video is meant to encourage awareness and communication with your healthcare provider. Nothing more. Your body is communicating with you all the time. By learning to listen to those signals, fatigue, breathing changes, discomfort, sleep shifts, you're becoming more aware of yourself. That awareness is powerful. It's not about worrying, it's about paying attention. The partnership between you and your doctor is where good health happens. You bring your awareness of your own body. Your doctor brings training and tools. Together, you make better decisions. Thank you for spending time learning about your own health. Take care of yourself and keep that conversation going with your doctor.